Treatment. The good news is that the pain and discomfort of canker sores can be reduced by readily available prescription and non-prescription treatments and home remedies. Simple cases of occasional canker sores are self-limiting, they will heal over and disappear without intervention. No remedies are proven to change the course of canker sores themselves or stop them returning. Treatments mostly just reduce pain, discomfort, and complication. Few treatments marketed for canker sores have been through extensive clinical testing. The management of canker sores is focused on treating symptoms, reducing inflammation, and promoting the healing process by countering secondary effects that could slow this down, such as bacterial infection. Treatments may include steroid mouth rinses, topical anesthetics, antiseptic ointments, rinses, or nutritional supplements. Home remedies for canker sores. The home remedy below is suggested by the U.S. Library of Medicine and can be followed 3 or 4 times a day. Rinse with mild, over-the-counter mouthwash or salt water. Do not swallow. Make a mixture that is half hydrogen peroxide and half water. Use a cotton swab to apply some of the mixture directly to the sore. Dab a small amount of milk of magnesia on the sore. So-called alternative therapies may also be worth trying. A review of the management of canker sores written for the journal American Family Physician listed a number of options, although it noted that there had been no randomized controlled trials to properly test safety and efficacy. Anecdotes of relief and better healing from sucking on zinc gluconate lozenges sold for the common cold. Vitamin C, vitamin B complex, and lysine may speed healing when taken orally at the onset of lesions. Sage and chamomile mouthwash 4 to 6 times a day may help. Infuse equal parts of the 2 herbs in water. Carrot, celery, and cantaloupe juices have been reported as helpful. Prescription therapies for canker sores. A doctor may prescribe antibiotics to minimize inflammatory irritation. More severe or persistent cases of canker sores need to be checked by a doctor to rule out associated conditions or to access prescription treatments. Again, any treatments aimed at the ulcers themselves are not certain to change their course, but can ease the symptoms. Antibiotics may be prescribed to minimize inflammatory irritation whether or not a bacterial infection is present. Anesthetics, as well as being available in consumer products for canker sores, may also be prescribed as topical preparations to ease irritation and pain. Some medicines designed for other conditions can sometimes be used. The American Academy of Oral and Maxillofacial Pathology, for example, cites an association between recurrent cases of canker sores and an overactive immune system, so topical immunosuppressant medications may help, such as locally applied cortisone. With a similar mode of action, topical corticosteroids are often considered by doctors. These include clobetasol ointment, dexamethasone rinse, and fluocinolone gel (Ladex). One possible side effect of using corticosteroids against canker sores is a fungal infection in the mouth. Particularly severe or recurrent cases of canker sores may be referred to an oral specialist who might consider systemic rather than locally applied topical drugs. These specialists may also be needed to make a more specific diagnosis. Some rare cases of recurrent canker sores are diagnosed as Sutton disease. Subscribe to my YouTube channel Baby Time FYI. Thank you.